Hello, everybody, and I hope you're all well, and lovely to have you joining me again for another Cat Cafe session. So today the focus remains with the urinary tract in many ways, but we're talking about a strategy which is really important for many of the different causes of urinary tract disease, which is to increase your cat's drinking and to therefore produce a larger volume of dilute urine if possible. And this is helpful for a number of different causes of lower urinary tract disease in cats. But there are actually some other situations where it's also helpful to encourage drinking and encourage production of more dilute urine. And so we'll look at that first of all, when it might be helpful to follow this strategy otherwise, in other words, and then we'll focus really the bulk of the next half hour or so on what sort of tactics I can recommend that are helpful to encourage your cats to take in more fluids. So firstly, let's look at the starting point. When might it be helpful? When might your vet recommend that it would be useful for your cat to take in more fluids, to drink more? And the answers to that include, firstly, the urinary tract diseases, as I've mentioned. So, for example, if your cat is vulnerable to stones, which are causing cystitis or even blockages, then actually it's helpful to encourage production of more watery, more dilute urine that flushes out those little crystals and hopefully stops stones from being formed within the bladder, for example, or elsewhere in the urinary tract. But also for many cats with idiopathic cystitis as well, it has been shown to be helpful for them to produce a larger volume of more watery urine in terms of their lower urinary tract signs. So hence including this presentation within our lower urinary tract disease focus. But beyond that, there are still other situations, and probably more than I've put on this slide, where actually encouraging your cat to drink could be very helpful. And the first of those would be if your cat has chronic kidney disease. This is a topic we spent some time, I think it was in April, talking about. So if you haven't seen those presentations, they're on the video tutorial page of the website, and you can go back and look at those. But those of you that do know something about CKD in cats will know that because of the cat's kidney disease, it leaves them vulnerable to becoming dehydrated. And therefore, encouraging drinking is often recommended so that the cat doesn't become dehydrated. Because the kidneys aren't working very well, they're losing more fluids than they should. And unless the cat drinks more to replace that, they're vulnerable to becoming dehydrated. So for these cats too, it's useful if we can get them to drink more than perhaps they would otherwise choose to do. And the last example I put on this slide was elderly cats in general. And the reason for this is that we know for a start that actually all cats are not very good at drinking. And this is probably partly because of their evolution. They started off as desert dwelling creatures, very good at producing small volumes of extremely concentrated urine and therefore having a low requirement for drinking. But unfortunately, they're also, even when things change, for example, when they do develop kidney problems, they're not always as good at drinking as they should be. They don't tend to have this strong, what we call thirst reflex or thirst response. So helping particularly those older cats that are more likely to suffer from kidney problems to drink more might also be sensible. And this, for example, might be one reason that you may recommend or a vet may recommend a wet food for an older cat, just because it's more helpful in terms of supporting hydration and reducing the risk of dehydration. For cats with lower urinary tract disease, there are actually a number of reasons, some of these more proven than others, as to why that might be helpful. So I've already alluded to some of these in the previous minutes, but it is certainly thought to be helpful to try and sort of flush through the bladder, if you like, so that rather than there being this sort of concentrated urine, which has quite painful substances like potassium, which can be a little bit irritant to the lining of the bladder when present in large amounts, if we can dilute that out, then the urine is not going to be causing any inflammation in those cats vulnerable to urinary tract disease, and we're going to just keep flushing things through the system. But also, hopefully, we're going to reduce the risk of stone formation in those cats that are vulnerable to forming bladder stones or stones elsewhere in their urinary tract. And then for cats with idiopathic cystitis, there also are a number of theories as to why feeding a more watery diet or encouraging thirst may be helpful in these cats. And I've listed some of these on the slide, and they include, as you can see, even just the fact that a wet food to eat rather than a dry food is a different sensation for the cat. Perhaps it might take longer to eat the same amount of calories, so that it may be a little bit more time consuming, a little bit more enriching, which may be important for those cats that perhaps live on their own indoors and they don't have much stimulation, and where stress is a feature, which we talked about a lot last week. Perhaps feeding a wet diet can be helpful there. There's also slightly different interaction with the owner when it comes to feeding wet rather than dry foods, and some people have hypothesized that that might have an impact on the cat's idiopathic cystitis as well. But the last bit of information on this slide, which you can see a reference to Markwell's paper 21 years ago, so 1999, a long time ago in science terms, but still doesn't feel that long ago to me. But this is really one of the big reasons that we started feeding wet foods to cats with urinary problems and also encouraging increased drinking, because this was a study actually performed through one of the pet food manufacturer companies, where they looked at cats with idiopathic cystitis, and they put the cats onto either a wet formulation of a urinary diet or a dry formulation of a urinary diet. And actually both of those formulations helped the cats, but they found a much better impact with the wet food rather than the dry food. So the recurrence rate, if you can see, was much lower with those cats that were fed a wet food, and their urine specific gravity, a measure of how watery the urine is, was lower in those cats on a wet food, which is not a surprise because basically cats, they don't normally drink that much. Therefore, a really good way of forcing fluid into them is to feed them a wet food. So this paper is often cited as one reason why we think encouraging drinking and feeding a wet diet are helpful in cats with lower urinary tract disease. And I've certainly found over the years it's really helped many of the cases that I've managed. So how can we do this? What are the tactics? Well, the ones that I'm going to present to you now are all also contained in one of the free downloads on the website. And so if you go to our website, click on the helpful info top menu, and then scroll down to free downloads, you will see a number of resources, some aimed at veterinary professionals, some aimed at cat owners. You do need to register to log in to access that information. There's no charge to do that, and we will only contact you ever again if you want us to, so we are totally GDPR compliant. But you will find a technical guide there which includes pretty much everything that I'm going to say this afternoon. So firstly, choose a suitable water bowl. Well, what do I mean by that? Well, there are a number of features. And firstly, many cats prefer to have metal, stainless steel or glass or ceramic dishes compared to plastic dishes. So if you are wanting to encourage your cat's drinking, that might be something to look at. Now, of course, there are always exceptions to every rule. And if you have a water bowl at home that is plastic and your cat loves it, do not change things, because this is, I'm making some general comments rather than specific to your cat. But in general terms, they tend not to prefer plastic. Sometimes the plastic can affect the taste, the flavour of the water, and that's thought to be a reason why. But do experiment a little bit with the different types of bowls, because you may find that some your cat prefers compared to others. Most cats also don't like their whiskers touching the side of a bowl, so whether it's eating or drinking, they prefer not to have to put their head into a bowl to eat or drink. So that means when it comes to drinking, shallow bowls are often quite good, and also full. So fill them to the brim, because cats prefer to just drink from the top of the water. When it comes to food and water, it is better often to separate these as much as possible. So this is the reference to the double bowl, and actually these cats are all eating, which you can probably tell, so they're not drinking. And there are a lot of cats in this household, and this was a convenient way for them all to get their food. But if you have one portion of this bowl as food and the other side is water, often the cat will not drink as much as if the bowls were completely separated. So again, if your cat's completely healthy, this may not be at all anything to worry about. But if you're wanting to encourage drinking in your cat, then physically separating, having a little bit of distance, maybe just a couple of feet or a little bit more between your food and water bowls is probably a good thing to try. And the reason behind that is thought to be that going back to their evolutionary heritage, if a cat was hunting and killing their prey species, that they wouldn't normally drink from water sources close to where they'd killed their prey in case they were contaminated by other things inside the prey species. So get bowel contents, for example, that might be a bit poisonous in the water. So that's thought to be the rationale why cats prefer separate food and water bowls. Have plenty of bowls. So if you have a big house and your cat spends time in all of your house and you're wanting to encourage it to drink more, then having plenty of bowls wherever your cat spends time is important, particularly if you have a cat that has arthritis or mobility problems, where perhaps the effort of just getting up and moving to a different room, even on the same level of the house, might seem just too much. So for those cats, just have a bowl wherever the cat likes to spend time. And if you do have more than one cat, as discussed last week when we were talking about stress and cystitis, it's important to look at the social groups in your home. So whether the cats get on with each other or not, and make sure that each group of cats has plenty of resources so they can't prevent other cats from in the household from accessing that food or water, for example. So I've already mentioned as well, away from the food bowl, so just another reminder of that. Also, try not to pick busy areas for anything that takes a little bit of time and you want your cat to be encouraged to do. So in the middle of a doorway obviously would not be a good place, but also by a noisy dishwasher or washing machine also might not be the favourite place for your cat to spend time drinking. And if that's something you want them to be encouraged to do, then perhaps find a quieter space to let them have that for their water bowl. And continuing that comment about old cats with arthritis and maybe not wanting to move too far to get to a food or water bowl or a litter box as well, then another thing that can help with the food and water is lifting up those bowls, because if you imagine the normal posture that our cats adopt when we offer them food at floor level, they're obviously crouched down and many of their joints are flexed, and if the joints are sore, then perhaps that's a little bit uncomfortable. Whereas if we can lift the bowl up, and there are some beautiful things out that you can buy, such as the example Chime is modelling in the right hand side of the picture, but equally easy to do is to open one of your kitchen cupboards and find a bowl or a tub that you can use to prop up your cat's food or water bowl, and that just lifts it up and makes it a little bit more comfortable for them to eat or drink out of. Another tactic that can help encourage drinking is moving water, and there are a huge number of water fountains available on the market. Many of these are plastic, but they still can be very popular, but there also are some enamel versions that I've seen. And again, if you've got one of these and your cat likes it, then definitely stick with it. Sometimes they can be a little bit noisy, and for some cats that's a little bit off-putting. And unfortunately, they're not cheap, so you can end up perhaps buying maybe one or two different ones and the cat doesn't like it, and that's frustrating. But they certainly can be popular in some situations. So again, that's something to consider. And you will all know as well, if you have moving water sources in your household, which your cat has already shown you that they like, then perhaps we can exploit that a little bit. So for example, Oscar here, who loved to drink from a dripping bathroom tap, when he developed illnesses as he got older that made him a bit thirstier, his owner used to just leave the tap dripping a little bit for him to be able to access that whenever he wanted to. And the shower tray or the bath could also be another place that your cat might like drinking a little puddle of water from. Obviously this picture is not really representative of that, but I just couldn't resist including it. This adorable cat I met one day walking on a harness very close to me, and his owner's a vet student, and she very kindly sent me various photos of Mr. Buddy that you can see here, having a little swim in the bath. He's quite an unusual little cat, but the bath certainly can be a popular drinking spot for cats as well. Other suggestions that you could potentially try, well, a shallow bowl with some ping pong balls to play in. That might be popular for a cat to come over and interact with the bowl a little bit and also spend some time drinking. Again, I didn't have a good photo of that, but I did add a photo of my old cat Hobie drinking out of a mug, which he did from time to time. So again, if you find something your cat likes doing, even if it seems a little bit odd, if it works, then you can carry on, you can use that, you can exploit that in favour of your cat drinking more. Also think about the different types of water that might be possible to offer to your cat. So we tend to use tap water, or most of us tend to use tap water, and depending on where we live, the tap water may or may not be terribly nice from a cat's perspective. It may be heavily fluorinated, for example. So we can, if we think that perhaps the taste of the water is something that may influence our cats, we can try other things. So we can try mineral water, we can try collecting rainwater, particularly if you see your cat that goes outside drinking from puddles or water butts in the garden, then that might give you a clue that that's a more preferred taste of water from their perspective. And beyond that, there may be other things that we can engineer that are tasty for a cat. So just a few examples appearing on this slide. And so some of these are relatively labour intensive, such as poaching some chicken or some fish in a pan of water, and then letting that water cool and giving that as a drink to the cat. And if the cat is allowed to have the chicken or fish to eat as well, then they can have that as well. Or we can even just simple things like if you buy a tin of tuna in spring water, then that spring water drained from the can, the cat can have that as a drink whilst you use the tuna to make your tuna sandwich. Frozen prawns, often there's a little bit of prawny flavoured water that will be residual in that bag that your cat can have as just a little bit of an extra. Or you could even just liquidize some of those frozen prawns in water and make a just sort of runny prawn infusion, which is as a drink for the cat. In some countries there are things that are marketed as water flavourers. I've not got any experience of these, but when we come to the questions at the end, I would love it if any of you have had experience of that and are happy to share it, whether you've tried products and whether you found them helpful. That would be great to hear. Certainly more recently in the UK, we've had a lot of cat soups and stews appear in our supermarkets. So these are often complementary foods designed as sort of extra little treats for the cats, and tend to be quite premium, so not quite expensive little treats for the cats, but can be very popular. And of course, where we're changing the cat's diet, do make sure that you discuss with your vet whether there are any reasons why whatever you're thinking of doing is perhaps not a good idea for your particular cat. And reference here may be particularly those cats with chronic kidney disease, where we want to be careful about how much protein and phosphate we give to these cats. So perhaps limit that a little bit and discuss with your vets. If you do find a technique which works as well, for example, the poaching the chicken or fish and creating that infusion of flavoured water for your cat to drink, you can freeze that in an ice cube tray and then just plop one of those infusion ice cubes into your cat's water bowl to provide that delicate aroma of fish or chicken or whatever it was, and that might encourage drinking. So have a little play with what works for you. Other tips might include, well, certainly make sure the water bowl looks appealing, that it looks clean and that the water is kept fresh. In general as well, cats will tend to prefer to drink water that is not too chilled. So in general, they'll prefer water at room temperature, or perhaps even just very slightly warmer than that, but lower than their body temperature clearly. But every cat is different. So here's one example, a patient of mine called Thibaut, and he liked to lick the condensation of a frozen bottle of water when it was brought out of the freezer and allowed to defrost. And this picture was kindly sent to me from his owner. So everyone is different, and some things work for some cats and not for others, hence including so many tips. Of course, as I said right at the start, if we're wanting to encourage water intake, then feeding a wet food is going to be a very effective way of achieving that, because in general, that's going to be much more successful than feeding a dry diet and doing all of these other techniques to help the cat or encourage the cat to drink more. But some cats will actually even eat food that is more watery than a normal wet food. And again, this could be something that is helpful if your cat has recurrent urinary problems or has chronic kidney disease, for example. And Beanie here, you probably can't really see it, you'll have to take my word, but there is just a liquid food in that bowl. You can just about see a shadow of a fluid line. And he was quite happy eating basically soup for his food. And again, room temperature or slightly cooler than body temperature is ideal. For cats that are what I would call a dry food addict, so a cat that just loves dry food and doesn't eat wet food at all normally, and you may have tried to tempt them with various wet foods and soups and so forth, and they're just not interested, then there are still some options here for ways that we can encourage water intake. And slightly bizarrely, in that it to me doesn't sound like it should work, but it does in some cases, is adding water to a dry food, which feels like a very strange thing to do. But if you have a cat that loves its biscuits, adding a little bit of water to the biscuits will swell a little and soften a little. Some cats actually will eat that when they will not eat the canned equivalent of the same food. So it is a little bit mysterious, but in some situations it does work. And if it does work, what I would do is start very gradually with an imperceptible almost amount of water, maybe a teaspoon or a dessert spoon, and gradually see how far I can push it. And again, sometimes owners have told me that their cat that is a dry food addict is now eating something that sort of looks like porridge, is fairly runny, looks fairly disgusting in our terms, but is an effective way of getting the cat to take more fluids. For cats with lower urinary tract disease specifically, there are some specially designed diets that are available to support urinary tract health that, for example, will dissolve certain types of stone, that will help to prevent formation of all types of stones, and also that encourage drinking. So there are some formulations such as the Royal Canin Esso urinary diet that are designed with multiple aims, including encouraging thirst in those cats receiving it. In general, still with the therapeutic diets, we would prefer a wet food to be eaten rather than a dry. But going back to those dry food addicts, if your cat is a dry food addict with urinary tract disease, this is one reason, in my opinion, to try and encourage them to eat one of the therapeutic urinary designed diets, because in that dry formulation, it will be likely to be much more effective in supporting the cat's urinary problems than any other dry food diet would be. Other tips? Well, definitely, as with many aspects of feline medicine, being persistent and trying not to be daunted or downhearted by any lack of apparent progress are, I think, useful tips to make, and view it all in little steps, baby steps, be gradual. Cats are very good at spotting when things have changed, and naturally, I think, a little bit suspicious. So if we can make the changes gradual, it's much more likely that we'll be effective. And also just remember that even if your efforts seem to be unrewarded, just whatever you're doing will be making a positive contribution to your cat. So stick with it. There are some liquids that are probably best avoided, or certainly discussed with your vet if you really do want to offer them to your cat. So very salty liquids, so like brine, which sometimes tuna cans, the tuna will be in this very salty brine, are probably not ideal because they have a lot of salt in them, and that may have other health repercussions. Milk, some cats love milk, not every cat does, but the problems or the downsides with milk are twofold really, in that firstly, if your cat has kidney disease, milk is really not the best drink for it because it has a lot of phosphate, and cats with kidney disease are vulnerable to accumulating phosphate anyway, so we really don't want to give them any more phosphate than that. So anything really dairy related is not ideal for a cat with kidney disease. And secondly, as I put here, some cats will have diarrhea when they're fed cow's milk. So that's, can be another downside from a health perspective, although it's probably more manageable in many cases. And then lastly, just to comment on safety of some things that we might use. So cats are quite sensitive to some things they just can't process in the way that we can, and that would include onions and garlic. So stock powders or stock solutions are generally a no-no in cats unless you can see that there is no onion and garlic within them. So avoid those otherwise, and just be careful with, for example, if you buy a pre-cooked chicken from a supermarket, or one of these chickens that comes in a bag already with herbs and spices and things in it, often there is garlic or onion powder on these, and so therefore giving the chicken meat or the juices from it to your cat could potentially have some harmful impact on their health. And then lastly, how do we assess the success of what we're doing? So if we're doing this for a reason, for example, a cat with lower urinary tract disease, that we want them to produce more dilute urine so that we reduce the risk of many of the causes of urinary problems, how can we actually monitor our success? Well, of course, we can be really scientific and try and monitor how much the cat is drinking, or if they're using a litter tray, we can measure the volume or the weight of the urine that they're passing. That is certainly possible, but probably the most helpful, and I think often quite straightforward thing to do, is to actually look at a urine sample. And collecting a urine sample from home is often not too difficult to do in cats. We have a download on the website on that, the same section that I referred to earlier, so under helpful info and free downloads. And if you collect a urine sample and then take that to your vets for analysis, they can look at the concentration of the urine using something called a refractometer, and that tells you the urine specific gravity. And I've taken a couple of pictures on this slide of what view you get as a clinician looking through your refractometer. So you put a drop of urine onto this device and then look through the eyepiece towards a light, so you can see this fluid line. You can see it's blue above and white below in both of those pictures, and then we I hope you can see my cursor, oops, yeah, hopefully. So then we look at the blue line, and on the left hand picture the urine specific gravity is just below what we would call 1040, so it's about 1038. There's multiple scales on here just to make it super confusing, but in the right hand image the urine specific gravity has come down now to about 1033, which may not sound like a massive amount, but actually it's pretty good news. So you can see that there is an impact of what we've done, and this is very doable at home. Just one word of caution, as I've put on here, that dipsticks, which we talked about a little bit in one of the earlier lower urinary tract webinars, they do potentially measure a lot of things, including urine specific gravity, but they're very, very unreliable in cats. So I would not bother to look at the USG reading on a refractometer if wanting to monitor progress of my cat with the tips that we've talked about today. If you're worried about hydration in your cat, so for example it has chronic kidney disease, then there are a number of ways you can assess how hydrated your cat is. So that little video is looking at what we call skin tenting, and I'll just play that one more time. So where we lift up a bit of skin behind the neck, and when we drop it, it should just spring back into place if your cat's hydration is good. But if it goes down a bit slowly, then that's an indicator that the cat's a little bit dehydrated. Other things we can look at as indicators of dehydration would include feeling the gums. So if your cat will let you just lift up a lip and look at the gums and touch the gums, they should feel quite moist. They should not feel sticky like blue tack. So we can get some indicators of hydration from looking at our cats at home, and that might indirectly tell us how effective we're being with our tips to encourage our cat to drink more. And as I mentioned with the CKD lectures as well, if we feel that we're unable to really do enough to maintain hydration, then giving fluids to a cat at home subcutaneously is very possible and usually very well tolerated by cat and carer, and is a practical option to consider if your cat with kidney disease is suffering from frequent or recurrent bouts of dehydration. So in summary, encouraging drinking definitely can be a helpful tactic in a number of situations, particularly cats with lower urinary tract disease and cats with chronic kidney disease. And there are lots and lots of tips in this presentation, and that's partly because none of them are perfect in isolation and every cat is different. So experimenting a little bit with your cat and what works best for them is definitely, I think, to be recommended. And I would love as well, if you have additional tips, things that I've not mentioned which you found helpful, I would really love it if you could share those with us in the Q&A afterwards, because that would be absolutely wonderful. My other summary points would be, again, really just sometimes it can be quite frustrating trying to do these things and not feeling like we're making much progress, but I think persistence often does pay off, and taking little baby steps to achieve your aim is often more successful in the long term than making a big leap for your cat where it's likely to just run in the opposite direction. So I hope that's been helpful. A reminder again of some of the additional resources that I've not mentioned. So the book, Caring for a Cat with Lower Urinary Tract Disease, written by myself and Professor Danielle Gunn-Moore, might be something helpful to you if you have a cat suffering from FLUTD. Also bear in mind that I do offer telephone referrals for cat owners. So if this is something that of interest to you, if you have a cat where things are a bit of a struggle, do consider that as an option. And if you would like a copy of the slides that I've used, please do feel free to request those via email and we can get those to you, or you can mention that in the chat box and we can get that through to you that way as well. And next week's Cat Cafe, just to mention that, is finishing off our lower urinary tract theme with talking about toileting accidents. So where cats in particular are urinating outside the litter box. Why does that happen and what can we do about that? So I hope you'll be able to join me next week for that. Thank you very much.